Hello, and welcome to Therapy Playground. I'm Ashley.
And I'm Julianne.
And we're here today to talk about feeding delays in your child. Julianne, can you please tell us a few red flags parents should be aware of if they have feeding concerns for their child?
Well, Ashley, some big red flags that a parent should be aware of is any choking, coughing, or gagging while eating. These are some things that should raise big concern, especially if the child is doing these more than once a feeding or during every feeding. If this is happening, then you should talk with your doctor and express your concerns. Some other things that you should look out for are your child's ability to chew foods, your child's ability to hold foods in their mouth without it coming out, any hypersensitivities or low muscle tone, if there's any overstuffing or extreme pickiness.
Can you explain extreme pickiness? Because I think a lot of parents are probably thinking, well, my child's picky, whose isn't?
I think a lot of parents confuse their child's pickiness. I think a lot of kids that are picky, they're picky for a reason. And it's important to be aware of the foods that they're eating and the foods that they're not, and why they're not eating those other foods. Some kids are picky because they can't chew certain foods, so they may stay away from foods that are harder for them to chew, such as meat and hard foods. They may stick to softer foods like pastas or mashed potatoes or applesauce. Those are safe foods and they're easy to chew, so they know that those foods are okay for them to eat. They're not going to worry about eating foods that are more difficult, or they may get tired of eating or trying to chew those foods, so they may stay away from those foods completely. There also may be kids that have hypersensitivity, so they may not like foods with a lot of flavor, so they may stick to foods that are blander, like mashed potatoes. And they may not like foods that have a lot of textures, so gritty foods, crunchy foods, they may like the smoother foods instead. So a good thing is to look out for your child's foods that he likes and the foods that he doesn't like, and be aware of why they're not eating those.
Wow, that's really interesting. So if we think our child has a feeding delay, what are the steps we can take to fix that?
What you should do if you feel that your child is having difficulty eating is to consult your child's pediatrician and express your concerns that you're having. Your doctor can refer you to your local speech-language pathologist, who can conduct evaluation and determine if your child does need feeding therapy or not.
A speech-language pathologist. I think a lot of people think that's someone that helps my child talk or understand what other people are saying, but what does a speech-language pathologist have to do with feeding?
Well, that's pretty funny, because when I first got into this profession when I was in school, I didn't realize that a speech-language pathologist dealt with feeding. I thought it was just, speaking. But if you think about it, all the muscles in your face that you use for speaking, they're the same muscles that you use for eating. So the speech-language pathologist really is the expert when it comes to feeding your child. There are other professions that work as a team with the speech-language pathologist to help your child progress in eating. Some of these other professions include an ENT, a physical therapist, an occupational therapist, a nutritionist, and a GI. These are just some of the main professions that are included in your child's feeding team.
So once you go see the speech-language pathologist for an evaluation, what happens during that evaluation?
Well, every evaluation is different because every therapist is different and every child is different. One of the main things that will occur is a detailed background history. The speech-language pathologist wants to know if there's anything in your child's developmental history or birth history that may...
Do you think maybe explain?
Yeah, that may explain why your child is having difficulties. The speech-language pathologist will also talk to the parent and get their perspective on the difficulties that their child is having. Some other things that will occur during the evaluation are observing the child eating foods that they like and observing their behaviors during eating foods that they don't like. The speech therapist will look at the child's ability to chew foods, to contain the food in their mouth. Is there any oral aversion to touch or foods? Is there any hypersensitivity observed? The therapist will look at your child's oral motor mechanism and see if there's any oral motor muscle weakness or low tone. All of these are things that the speech language pathologist will look at.
Wow. So what happens if they qualify for therapy? How long is therapy? What should a parent of a child with feeding issues expect?
Well, the parents should expect feeding therapy once a week for 30 minutes. It's very difficult for a feeding therapist to conduct feeding therapy in 30 minutes because it really does take longer than that. But unfortunately, that is all most insurances will pay. So it is very important for the family to be involved. The speech language pathologist will work with the parents and family and teach them tools for being able to help their child eat successfully. That way, the parents can carry it over and the child is able to eat in a safe and fun environment.
Wow, Julianne, that's been a lot of great information. Unfortunately, I think we could talk about feeding all day, but we have run out of time. If you have a child that you feel has a feeding delay, we ask that you talk to your pediatrician or your speech language pathologist. Hopefully we'll see you again soon. Thank you and have a wonderful day.
Bye!